Good morning all. I'd firstly like to thank Professor Anatine Carroll for the opportunity for me to share my story with you today. I hope you found my experience useful in setting the scene for today's talks and why we're all here. My name is Archie Veale and I'm 16 years old. I'm currently studying product design at AHS and resitting my GCSEs from last summer. Throughout my teen years I've had an active lifestyle. I played rugby for the school second team, did a lot of cycling and went to the gym at least 5 times a week. As I'm sure most teenage boys do, I spent a lot of time with my friends, socialising and doing sporting activities. In the run-up to my illness, I was studying hard to prepare for my GCSE exams. I was set to take French, engineering, geography and history, in addition to my compulsory subjects. I was on track for some great results, with predicted B's, A's and A stars. In early March of 2014, I'd been complaining of backache, and on the morning of the 8th of March, my parents arranged for an osteopath to come and visit me at home. He worked on my back, but unfortunately there was little improvement that night or the morning after. The pain worsened, and on Sunday the 9th of March 2014, I was taken to my local A&E at Nobles Hospital on the Isle of Man, but although urine and blood samples were taken, I was sent home with some strong painkillers. Overnight, I was still in a lot of pain and could not sleep at all. Therefore, my dad took me to the GP to see if he could give me something to help me sleep. As I staggered into the doctor's surgery with one arm around Dad, they could clearly see something was not right. My GP took one look at me and then took my blood pressure and called 999, where I was taken to intensive care with a suspected infection. This is where my adventure really begins. Now, I intentionally use the word adventure, as the Oxford Dictionary definition is an unusual and exciting or daring experience, which certainly sums up my journey over the past 13 months. On the 10th of March 2014, it was confirmed in the MRI scanner that I had an infection racing through my veins. After sedation, plans were in place to take me to Alderhay Children's Hospital, where they hoped the medical professionals there would have more idea of what to do with me. The task of getting me to Alderhay was given to the North West and North Wales Paediatric Transport Service. I was taken by air ambulance from Nobles Hospital to Alderhay. On arrival at Alderhay, I was rushed straight into the intensive care unit, where numerous teams of medical professionals awaited me. By growing blood cultures, it was discovered that I was suffering from Staphylococcus aureus Panton-Valentine leukocidin positive septicemia, and that I had a C-reactive protein marker of over 300. The PVL was attacking all of my organs, so therefore I was connected to continuous veno-venous hemofiltration to do the work of my now failing kidneys, ventilated via tracheostomy to pump air into my abscess-covered collapsed lungs, and to give my heart and lungs a rest, I was connected to the extracorporeal membrane oxygenation machine, or ECMO for short. There we go. The ECMO wasn't connected as smoothly as some may have wished, however. The ECMO team had tried to connect me through keyhole surgery in my groin and go through one of my main arteries, but despite being 6 foot tall, my arteries were still only the size of a child's. This meant it was necessary for them to connect it straight into my heart, and through my chest they went. By this time, I'd developed compartment syndrome in my right leg. The muscles were swelling more and more in search of oxygen. But this led to them pressing against my nerves and vessels, so an emergency fasciotomy was required to release the pressure. This area had to be left open in order for the tension to be relieved. The surgeons, doctors and nurses tell me now that it was like a dog chasing its tail. As they were putting blood products in, they were coming out of my leg again. This meant I had around 18 litres of blood product pumped through me in order to keep me alive. Luckily for me, I was sedated for the first 3 weeks of my stay at Alderhay, so I didn't stress or panic about this. And luckily for my family and friends, these 3 weeks were extremely touch and go with my condition. As I came round from sedation, the ordeal was certainly not over. After having been sedated for such a long period of time, I had lost 2 stone in weight and had developed a critical illness neuropathy and myopathy. At first, there was next to no movement anywhere throughout my body. And due to my tracheostomy, I could not talk. This was extremely hard for me, as I could not communicate any worries I had, and there were a lot of them. Fortunately, however, my parents quickly picked up lip reading and were able to interpret what I was trying to say. To improve movement and to rebuild muscle strength, I was having extensive physiotherapy from day one. We mainly worked on regaining movement and rebuilding strength in my upper body in the early days to get me as independent as possible in the scenario I was in. Over time, a little twitch in one finger became a hand movement, then an whole arm could move. Strength and movement was gradually returning. Whilst in intensive care, I was involved in a few studies, the main one being the Euclid study. This stands for the European Union Childhood Life-Threatening Infectious Diseases Study. This study is looking for a genetic reason why some people react differently to infections than others, and is trying to find a better way to diagnose, treat and prevent infections. After a 37-day stay on intensive care, the time came for me to be released onto the neuro wards. Firstly, Neuro HDU. Here, I was still on a lot of medication, which in itself was extremely challenging. Due to the fact I was on such strong drugs for such a lengthy period of time, I was experiencing hallucinations, anxiety, depression and apnea. As I was slowly weaned off my medication, my level of physiotherapy was creeping up. Once almost all of the medication was out of my system, I was put onto the Neurosurgery Ward. The physiotherapy team played a huge role in my recovery from this time onwards. They were full of encouragement and enthusiasm, and have truly helped me to get to where I am today. It was on this ward where I first began my hydrotherapy. I thoroughly enjoyed going down to hydroing, as it gave me a freedom which I did not have at that time. Whilst I still had my tracheostomy in, I was supported by at least one member of the hydrotherapy department and was covered in floats. As soon as my tracheostomy was out, however, I was let loose in the pool, and due to vast improvements in a short period of time, the staff there managed to get me in the pool 5 days a week. Continuing to improve in physio, both in and out of the pool, I was moved to the Neurological Rehab Ward. When on the Neuro Rehab Ward, my physiotherapy and hydrotherapy continued, Monday to Friday, but I was also introduced into the ward school. I often did activities which would improve my fine motor skills, as my myopathy had affected my hands greatly. In addition to this, I was also on a brain training program called CogMed to try and rebuild my cognitive memory. After 7 weeks on Neuro Rehab, I was finally allowed my first weekend back to the Isle of Man. It was so nice to relax and see my family and friends at my own house for the first time in almost 4 months. It was my next trip home, however, which is the most memorable. This was the weekend of my high school prom. All the boys got suited up and the girls put on their posh dresses. This was the first time I'd seen all of my peers since I first went to Alderhay. It was an emotional and monumental day. After a few weekends home, I was finally discharged from Alderhay Children's Hospital on the 1st of August 2014. This brought my total stay of 145 days to an end. However, these were certainly 145 days of my life which needed to be spent in a place like Alderhay with the fantastic life-saving staff they have. Once home, I continued to have physiotherapy and still continue my physio to this day. I see my physiotherapist Jamie and do an independent gym program each week, both of which are funded by the NHS. In addition to this, I have private physio to try and speed up my recovery that little bit more. I go on an Alter-G anti-gravity treadmill and play wheelchair basketball and have a session of hydrotherapy as well as swimming for fitness as often as I can. When I'm not in physio, I'm back in school trying to catch up on last year's work which I missed whilst in hospital, as well as my exams. I currently have done 2 of my GCSEs and I'm aiming to sit 7 more over the next few months. I recently have been getting back into the social aspect of my life. Due to the fact I'm only back at school part-time, I do not get much chance to see all of my friends during our morning or lunch breaks. At first, it was difficult for me to see my friends as I was confined to my wheelchair, and we couldn't do the things we used to do. But now I'm much more mobile. The fact that some of my friends have passed their driving tests, we are able to do much more, and I see them often. So, is there anything that could have been done to prevent the year I've had? I believe so. You may have noticed that early on in my talk, I said, although urine and blood samples were taken, I was sent home with some strong painkillers. However, I did not say anything about the results of these tests. My family had presumed that they'd come back negative, and the doctor had no major concerns about my condition. Well, why wouldn't we? We should surely have faith in this medical professional, right? A couple of weeks ago, my dad and I attended a meeting with the manager of A&E at Nobles Hospital, and he told us that I had two major telltale signs of the early stages of infection, and that an opportunity was definitely missed on that day, Sunday the 9th of March 2014. The doctor who looked after me whilst I was in A&E took no notice that there was glucose in my urine and that my blood sugar levels were high. Even more so, he didn't put in my notes that I was coughing up blood. It is hard to say whether being on the antibiotics those 24 hours earlier would have changed the way events unfolded for me, but unfortunately we'll never know. At the same meeting, we were reassured by the staff at Nobles that a more consistent and formalised approach to assessing for infection is in place, based on the sepsis 6. I hope that after today, more tests for septicemia are more routinely performed by hospitals across the UK, so less people have to endure what I've experienced. In addition to tests being done more often, I think it needs to be widely recognised that sepsis can present itself in many different ways. In my case, it was backache, showing it's not always apparent in the most obvious of ways. I strongly believe that this is something everyone needs to be aware of. Before suffering from septicemia, I didn't know what it was or how serious it can be. I unfortunately had to learn the hard way. My experience has made me want to increase the awareness and knowledge of infections, septicemia in particular, and hopefully this will lead to improved treatments. Fortunately for me, I have made an extremely good recovery so far and appear to be continuously improving. This isn't the way experiences like mine always end. Thank you.